region, and residents along the Kasoa Winneba stretch are raising concerns over the possible outbreak of respiratory diseases. The residents say the dust emanating from the construction of the Kasoa Winneba highway has become unbearable despite appeals for the contractors to constantly water the grounds. Our Central Regional correspondent Akosiado has more in the following report.
Few months ago, 60-year-old Elizabeth Aqua, who stood at the cooking area in her house at Gomuapotin Junction, was hit by a car that veered off the road. That accident has since left her an injury which has made life uncomfortable for her. According to her, the driver who ran into her blamed the dust for poor visibility. In a similar occurrence, Kofi Edufo, in his 50s, was also crashed by a vehicle on December 10, 2025, causing his immediate death. Ebo Anderson, leader of a local emergency response team, told ChannelOne News several other road accidents have occurred as a result of the heavy dust, which impacts visibility.
He had almost crossed the road, but because of this same incident of dust, and it also happened in the darkness, so 2 in 1. According to the driver, he did not see that this pedestrian was crossing the road.
The contractor undertaking the 30-kilometer Kasoa Winneba Road expansion works, NAC Fremont Limited, has failed to spray the stretch with water routinely to mitigate the dust. Regular users of the road say they are being heavily affected.
We agree that they are connecting the road for us. They are reconstructing the road to ensure for our purposes of use, which is good. It's in a good taste, but the dust is not really helping us.
Commercial drivers are equally not happy with the situation.
Instead of the road instead of the motors na we yakwan susa omunya abotre na omu di speed even no motor le pano kwa on makwan motor otum bomfutura na wan hwekwa na wo kwa akosefu mu.
Business operators also say their businesses have been severely hit as they record low sales.
Oh, the man was first, but no smarter. I teacher me. Debia Mokwada, Chisa Missensu, with the main water, me, Ntiaba, near the Antoma, Apapra, no one san, so I can cry, Yasan, Apapra, and the man to the Tama, Yabopon Kufi. A young man, you know why you want to be about the Noban and Huntman one. The way I ain't on Tona, Hunto and Jama cousin, probably one fire. What for baby for Frontama? Yeah, the turning in I say.
Residential apartments, particularly those closer to the road project, are filled with dust, according to residents.
Often in tutu nedi. Sempre mo kwachira o medan na aswade dan a anapeyara ma pepeme tutu ogumen. De biara yin mi de kira me de mof mo pepemi nyina ran san de yetum ya aswaro.
Me bon wa ayi firimo. Ya frana sen ade firimo mo no. Ya agro. Ade person mo ya no every day bi o mutumi water ne be 4 times the maya. Okay.
Apart from eye infections, some residents say they are battling signs of respiratory infections, leading to hospitalization.
You mentioned respiratory disease. Every 2 weeks or a month, I have to visit the polyclinic because of respiratory infections. Sometimes I used to close around 8 o'clock, but I can't close around 8 because if I stay here till 8 o'clock, I'll get sick. You can take a stroll and then go to where they are working right now. The place is well watered, but when they come to where we are living and there's no work here, they don't water it.
At the Gomuapotin Polyclinic, upper respiratory tract infection cases have surged. Officials say 1 out of every 5 patients present signs of respiratory and eye infections.
Without going into the specifics of the data that is readily available at the information system, you realize that almost 1 out of every 5 patients now has a respiratory related problem that a doctor needs to see. If it's not respiratory related, then it's going to be eye related. So 1 out of every 5 now are coming in with these respiratory diseases.
Medical superintendent at the facility, Dr. Vlad Nkegbe, remains worried about a possible health crisis should nothing be done about the situation.
The worry more is for the asthmatics especially those who ply the road, who live by the roadside. Even the feeder roads are not left out of the equation. So yes, the burden is really increasing, but it's a worry.
Late last year, officials of the construction firm announced a lane was going to be opened to traffic by December 2025. However, there has been a delay in keeping that pledge. Road users as well as residents, apart from asking for the project to be expedited, remain disappointed and extremely worried about the dusty nature of the stretch. They are demanding for an intervention that will cause the contractor to routinely water the road to mitigate dust and prevent infections.
Beginning, we thought that because there was too much traffic on this road and then they were going to do road expansion, we embraced this thing. But now, if you ask me that, is this thing beneficial to you, I would say no. Why? Because every 2 weeks, I have to visit the hospital.
One death has already been recorded here in Gomuapotin. There's been a number of respiratory infection cases, perhaps before the road construction is done. Several residents may be living with ailments. For the ChannelOne newsroom, I am Kasoa, Gomuapotin, Central Region.